Before you can make a decision, you need to recognize what matters. The acronym FAST was developed as a public awareness tool to identify strokes, but nurses use it differently. We use it to think fast, to recognize neurologic changes before they ever become a critical, urgent priority. So FAST stands for face, arms, speech, and time, and all four of those things directly connect to clinical judgment. The first three parts of this acronym can easily be mistaken for other problems. So F for face, we're looking for a facial droop, and this is not telling us that we have one side of the face that's weak. It's telling us that there's a neurologic problem and there's an inability to control both sides of the face equally. We see asymmetry, or things that are not the same on both sides. In A for arm, we're looking for arm drift. If you hold both arms out, does one tend to drift away, drift down toward the floor? And that is not about weakness. That's about the brain's ability to maintain motor control. And when we see a speech problem, slurred speech or slowed speech, it's not about anxiety or confusion. It's about the brain's communication center not functioning properly, and a person isn't able to get the words out clearly. And T is for time, and this is the one that matters the most to nurses. When was the patient last seen well, fully functioning? And the reason this is important is because it tells us how much time we have to get the CAT scan, to get that imaging done, how much time we have to get labs and other diagnostics completed, how much time do we have to be sure that the patient can receive thrombolytic meds, clot buster drugs if they're eligible, and overall, just how much time does the team have to save this person's life? So yes, FAST was designed for the public, but nurses use it too, and we just use it in a different way. We use it to be able to recognize cues that a stroke is happening fast. We need to know that before the CAT scan results, before the labs, before the other orders are written. We want to recognize those cues quickly. Clinical judgment starts with the ability to recognize cues early, and FAST helps nurses do just that.